Okay, so good afternoon to everybody. Before I started my presentation, I would like to assure you that I'm very well aware that I'm the last speaker today, and I know that most of you are a little bit tired and a little bit nervous waiting for a dinner. So I will really try to squeeze my presentation as much as possible, but it depends a little bit of my English pronunciation, and of course, I don't want to skip great actions, great results that we have in EPAAC, since it was said already earlier before me that we have really ambitious goals and objectives, and you can imagine that in 16 months we also try to do a lot of it. So what I will skip in presentation, it's horizontal work packages, and I will go directly to core work packages, since these horizontal are just supporting the action itself, and you will see the results through the results of the core work packages. So the first one on health promotion and prevention. We heard also earlier that 1/3 of all cancer can be preventable, but I would like to stress here that the prevention is most cost-effective long-term strategy for the control of the cancer. So these work packages led by European Cancer League is concentrating on, in fact, raising awareness about health promotion and cancer prevention in a way that they disseminate European codes against cancer. They also relaunch European week against cancer, and by engaging, this is very important, policymakers at European, national and subnational levels. The relaunch of the European Week Against Cancer happened already last year in Brussels, and this year we had the second EVA conference in course of EPAAC here in Rome, organized by Italian Cancer League with major themes: tobacco control, screening and healthy lifestyles. Since the youth presents one of the target groups for the health promotion, there were a few activities in supporting this objective. Flash mobs were executed in different European cities as a specific action that attracts youths, and additionally the youth competition was organized targeting youth from 11 to 18 years old. We had groups from all over Europe. They were preparing posters, they were preparing videos with messages on code against cancer. But we will hear more about this tomorrow, and we will also hear about the results of the competition. So therefore I will move to the next work package. This one is work package on screening and early detection, and this work package is led by Finnish Cancer Society. The work of this work package is organized around 4 major objectives. So you can see this slide. To support the achievement of establishing an intensive, comprehensive training course in management of cancer screening programs. There are listed actions, what they were doing for past 16 months. So you can see meeting of senior management team in May 2012 for designing the course and to make the curriculum preparations. It was also decided to have a first week module already in November at IARC and the second week module in March 2013. The first announcement and invitations are prepared, almost finished, I can say, and they will be released now in June. So I would like to invite you all interested in these modules to follow us at the EPAAC website, because this will be released very soon, I think next week. I spoke to David Ahti. Additionally, a report on pilot audit of screening management program conducted in January was completed just now in June. The second objective is to identify the inequalities in cancer screening programs. Therefore, the analysis of results of cervix and breast cancer screening was done. There is ongoing preparation of the report on a literature review on participation and compliance, and this one is targeted to be finished in July this year. At the same time, there were activities on preparation of survey design and plan, and this one is also targeted to be finished this year in September. To facilitate expert advice to regions seeking to implement or to improve cancer screening programs, we had the first workshop on colorectal cancer screening program. This one was held this year in March in Liverpool. Report is already completed. The second screening workshop is also planned for this year, and it will be in October in Italy, and the theme is cervical cancers, cervical cancer screening program. The draft is already developed. Keynote speaker and other speakers also already invited. Cervical cancer screening program survey was drafted. Now it's in the testing phase, and 26 regions and member states are identified to receive the survey. And the last objective is, as you can see on the health checks, to develop a pan-European consensus on quality criteria for health checks. The survey, a survey on the applicability of Netherlands experience to other member states was prepared. The deadline for the competition was moved to May, and the NEN is exerting further efforts to disseminate and to follow up responses of the survey. The work package on cancer healthcare is led by Instituto Catalania d'Oncologia, and its work is organized around the three major objectives with many specific actions. Listed on this slide are ongoing activities that are planned to be finished this year. So you can see here to set criteria for identifying and assessing best practices focusing on organizational approaches. The actions on literature review on multidisciplinary care and the qualitative review of networks of cancer care are also ongoing, and these two are expected to be finished by September this year. Criteria for literature review on assessing evidence and use of complementary and alternative medicine in cancer care are in development. We are expecting these by the end of the year. The review of experiences on implementing clinical guidelines with focus on addressing inequalities like access to healthcare are expected in October this year. Here you can see the activities that are planned and achieved till now. So the International Conference to Increase Policy Awareness on Standards of Care for Children with Cancer was organized already and finished in October in Poland, 2011. And currently these standards are disseminated. To improve treatment, symptom assessment and follow-up of palliative care through a standardized methodology and evidence-based guidelines, the expert meeting was held in January. Report is preparation with also scientific publication expected. So the work package on coordination of cancer research, this work package is led by European Cancer Organization. They were acting on three levels. As you can see, first level includes input from scientific community on areas of cancer research that would benefit from coordination. The second level is input from cancer research funders on the funding landscape. And the third one was the meeting with the member states. This one was organized in Germany this year, hosted by German Ministry of Health. And this was on cancer research coordination. But at the moment, this work package is preparing the research forum, and this one will be held 2nd of July in Brussels. This meeting will involve cancer research funders, researchers, patients, and policymakers to enable them to discuss and agree on potential areas for coordination between member states. Here you can see also some examples like public-private partnership for early phase clinical research, platform for outcomes research, innovative approaches for improving coordination and collaboration. Since the cancer information and data is one of the main topics of this open forum, we will hear about it much more extensively tomorrow on the second day of the open forum. So today I will give you just very basic information on what was done in past 16 months. So this work package led by Istituto Nazionale dei Tumori is ahead with the proposed work, and the draft proposal for a future European cancer information system is discussed in the meetings with different representatives coming from IARC, European Network of Cancer Registries, European Commission, Joint Research Center, and also other European institutions and projects. In contribution to the second objectives of the Work Package 9, unification of cancer burden indicators under the common platform, the preparation of cancer survival data of patients diagnosed from 2000 to 2004 to be included in HIDI and the future ECIS is already done, as well as establishment of contacts with HIDI in order to investigate the feasibility of posting cancer indicators. Additionally, the ISPRA meeting between Eurochip, Eurocare and EPAAC was held, aiming to connect this work package with other European initiatives and activities. Knowing that cancer incidence is increasing and that the cancer costs are increasing even faster than the available resources, it is very important to have standardized and comparable data on cancer costs on the European level. In this regard, OECD Activity on System Health Accounts was connected with EPAAC Work Package 9. Beside mentioned activities, the collection of socioeconomic data for regression analysis already started, and the data collection for national cancer registry areas almost concluded. Regarding the work package on national cancer plans, this one is led by National Institute of Public Health Slovenia. Much work was done in preparing the report on national cancer plans. First, we prepared questionnaires. These were sent to all member states, plus Norway and Iceland. We got 100% response rate, and the first draft report on national cancer plan was commented already in steering committee meeting in Ljubljana in 2011. At the core working group meeting in Malta in February 2012, it was decided to have two types of report. First is technical report focused on the response analysis of the questionnaires, and the second is a full analysis of the questionnaires with the background, methodology, conclusions, and recommendations. The final version of the technical report is completed just now in June, and now the hot topics in this work package are the guidelines, so we now call them guide for the high-level national cancer plans, as well as the respective indicators. At the end of my presentation, I would like to say a few words on the dissemination activities, which are very important for us, since it's in fact a phase of the partnership that is showing to the different stakeholders and interested publics. On our website, as you can see, from May, we have two major improvements. So we add two sections or subsections, open forum and steering committee section. Here you can find all relating information to open forums and steering committee meetings, discussions, and also conclusions. And we add also EPAAC Gantt chart. This gives you latest updates on project milestones and deliverables with links to available documents. And this one looks like this. So as you can see in the columns, you will see the results of specific work packages, and if they are green, it means they are finished, and usually you will find the links to milestone or deliverable. If they are in yellow, it means that we are actively working on these. Red means that we are slightly behind our schedule, but usually we try to avoid these ones. So we are also active on the social media, so Facebook, Twitter, YouTube, but I would like to say just a short few words about the social campaign that we are preparing for this autumn. This will be a special social game application to be used as a platform to promote cancer prevention. We will try to motivate users through gamification to engage with our mission and values, and of course to do actions. Facebook users will become our activists, and they will probably recruit their friends to also do actions for good cause. So I would like to use this opportunity to invite you to join us this autumn on the Facebook and help us to share our content via your Facebook friends, because action counts. So at the end, I would like to thank to all our partners for a great job they are doing. And special thanks go to our work package leaders. So I don't see all of them, but Wendy, Ahti, Giuseppe, Ingrid, Milena, Tit, Matic, Tina, thank you. I hope I didn't forget anyone. Okay.